Hi, myself Divya, Assistant Professor, Department of Nursing Foundation, Yenepoya Nursing College, Yenepoya, deemed to be university. Today, in this session, we will discuss about Introduction to Pain, Types and Physiology of Pain. First, let us see what are the learning objectives of this session. At the end of the session, students will be able to define pain and list the factors influencing pain, understand the nature of pain, mention the types of pain, explain the physiology of pain and list down the signs and symptoms of pain. To begin with, pain is a universal but individual experience. We all experience pain, but still it is purely subjective experience. And it is a condition that nurses encounter among all the patients in all settings. It is the most common reason that people seek health care, yet it is often under-recognized, misunderstood and inadequately treated. Pain is common in many illnesses, experienced with variable periods. Therapeutically, it is used as an diagnostic tool and it is also used as an assessment variable and as a measure to check the effectiveness of interventions. Next, we'll see what is the definition of pain. According to International Association for the Study of Pain, pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. Pain is not just a physical sensation, it is also an emotional response associated with actual tissue damage, and sometimes without the presence of the tissue damage, person experiences pain. Example, pain of grief at death of a loved one. Next, we'll see what are the factors influencing pain. The factors like developmental factors, physiological factors, social factors, psychological factors and cultural factors. Developmental factors such as age. Age influences the pain perception, especially in the infants and older adults. Young children have trouble understanding pain and the procedures that cause it, whereas older adults have a greater likelihood of developing pathological conditions which are accompanied by the pain. Next, physiological factors such as fatigue. Fatigue often heightens the perception of pain and it decreases the coping abilities. Pain is often experienced less after a restful sleep than at the end of a long day. Next, genes. Research on healthy human subjects suggests that genetic information which is passed on from the parents to children possibly increases or decreases the person's sensitivity to the pain, and it determines the pain threshold or pain tolerance. Next physiological factor is neurological function. We all know for the pain perception, nervous system plays a vital role. If there is any interruption in the pain transmission from the pain receptors to the nervous system, it will affect the patient's awareness and response to the pain. Next one is social factors. Social factors like attention. An individual who focuses his attention more on pain will experience more pain. Increased attention is associated with the increased pain, whereas distraction is associated with the diminished pain response. Next social factor is previous experience. If a person repeatedly experiences the same type of pain that was relieved successfully in the past, the client finds it easier to interpret the pain sensation. If a person is having a worst experience in the past, may experience much pain. Next one is family and social support. The presence of family or friends can often make the pain experience less stressful. That's why it is important in case of children, the presence of parents is required to make them less stressful. That's why it is important that presence of parents is especially important for children experiencing pain. Next social factor is spiritual factor. The spiritual questions include, why has this happened to me? When the person is experiencing chronic and severe pain, often questions God that why I am suffering, why has God done this to me, and is this suffering teaching me something? So these kind of feelings, if the person is experiencing like this feelings, it makes him much painful. Next one is psychological factors. First one is anxiety. Anxiety often increases the perception of pain, and pain causes feelings of anxiety. Sometimes in the anxiety, even in the absence of tissue damage, the person experiences pain. Example, pain experienced by a person before the needle pricks his body. This happens mainly because of the anxiety and perceiving for the threat. Critically ill or injured patients who perceive a lack of control over their environment and care have high anxiety level. This anxiety leads to severe pain. Next one is coping style. Persons with the better coping level perceives less pain than the person with the lower coping levels. The last factor is cultural factors. Cultural beliefs and values affect how individuals cope with the pain. Individuals learn what is expected and accepted by their culture, including how to react to the pain. Culture affects the pain expression. Some cultures believe that it is natural to be demonstrative about the pain, and others tend to be more introverted. So these all are about the factors influencing pain. Next we'll see what are the nature of pain. Pain is subjective and highly individualized. Only the patient knows the pain is present and how the experience feels. And every time it is not important that only the physical stimulus can cause pain, it can be mental in nature. Pain may not be directly proportional to the amount of tissue injury. Since pain is complex, it includes many components like physical, mental, emotional. It is not always because of the tissue injury. So that's about the nature of pain. Next we'll see what are the types of pain. Pain is classified based on the duration, based on the location, based on intensity, based on etiology. First we'll see what are the types based on duration. Based on the duration, there are mainly two types, that is acute pain and chronic pain. Acute pain is intense and of short duration and usually lasts less than 6 months. Whereas chronic pain is lasting longer than 6 months and sometimes it is continuous and sometimes intermittent. We'll see in detail about the acute pain. Acute pain lasts only through the expected recovery period and it is protective in nature and it has an identifiable cause and it is for a short duration. It have limited tissue damage and emotional response. It eventually resolves with or without treatment after an injured area heals. Next one is chronic pain. Chronic pain is the pain that lasts longer than 6 months and is constant or recurring with the mild to severe intensity. Examples: arthritic pain, headache, peripheral neuropathy. Chronic pain may be chronic non-cancer pain, chronic cancer pain, chronic episodic pain. Chronic non-cancer pain resulting from the causes other than cancer conditions is termed as chronic non-cancer pain. For example, arthritic pain. Next one is chronic cancer pain. So, cancer pain is the pain that is caused by tumor progression and its pathological processes, invasive procedures, toxicities of treatment, infection and physical limitations. So, pain caused by the cancer is called as chronic cancer pain. Chronic episodic pain. Pain that occurs sporadically over an extended period of time is known as episodic pain. Pain episodes last for hours, days or weeks. Example, migraine headache. So these are the different kinds of chronic pain. Next, the classification of pain based on the location. This is based on the site at which the pain is located. For example, headache, back pain, joint pain, stomach pain and cardiac pain. There is one more type of pain which comes under the classification of based on location, that is referred pain. When the pain is away from its origin or pain due to problems in other areas manifest in different part of the body is known as referred pain. Example, cardiac pain which is felt in the shoulder, left arm with or without chest pain. Next classification is based on the intensity. There are mainly three types, that is mild pain, moderate pain and severe pain. To know whether the person have mild, moderate or severe pain, we need a help of a pain scale. Based on the score obtained by the pain scale, patient is classified as mild pain, moderate pain or severe pain. Pain is classified as mild pain, moderate pain and severe pain. Mild pain, when the pain scale reading is between 1 to 3, it is considered as mild pain. Moderate pain, when the pain scale reading falls between 4 to 6, is considered as moderate pain. If the pain scale reading is 7 to 10, then it is considered as severe pain. Classification of pain based on etiology. So based on the etiology, there are mainly two types, that is nociceptive pain and neuropathic pain. Under nociceptive pain, there are somatic pain and visceral pain. Under neuropathic pain, there are two types, that is peripheral neuropathic pain and central neuropathic pain. Nociceptive pain. Nociceptive pain is experienced when an intact, properly functioning nervous system sends a signal that tissues are damaged, requiring attention and proper care. This happens when the pain receptors or the nociceptors receives the pain stimulus and they send the signal to the nervous system. Under that, there are two types, that is somatic and visceral pain. Somatic pain is the pain which is originating from the skin, muscles, bone or connective tissue. This is the sharp sensation of a paper cut or aching of a sprained ankle are common examples of somatic pain. Next one is visceral pain. Visceral pain that results from the activation of nociceptors which are present in the visceral organs like thoracic, pelvic and abdominal viscera. And the pain experienced in the visceral pain is characterized by cramping, throbbing, pressing or aching qualities. Examples of visceral pain are labor pain and angina pectoris. Next one is neuropathic pain. So we can call it as pain caused by the neurons. Neuropathic pain is associated with the damage of a nerve due to an illness or malfunctioning of a nerve due to an illness or injury or undetermined reasons. Examples of neuropathic pain are diabetic peripheral neuropathy, phantom limb pain, spinal cord injury pain. Neuropathic pain is of two types, based on which part of the nervous system is damaged: peripheral neuropathic pain and central neuropathic pain. Peripheral neuropathic pain occurs when there is damage happens to the peripheral nervous system. Example, phantom limb pain, where phantom limb pain is nothing but when the person experiences pain from a body part which is no longer exist. Example, after an amputation. Central neuropathic pain, it results from malfunctioning nerves in the central nervous system. Example, spinal cord injury pain, post-stroke pain. So that's about the classification of pain. Next, we'll see what is the physiology of pain. Pain occurs when the sensory nerve endings known as nociceptors or pain receptors come into contact with the painful noxious stimuli. So nociceptors are the primary afferent neurons which receives the signals or which receives the stimulus, and it converts the signals into electrical impulses. A nociceptor is a sensory neuron that responds to the damaging or potentially damaging stimuli by sending possible threat signal to the spinal cord or the brain. There are mainly three types of pain receptors, that is mechanical, thermal and chemical. Physiology of pain includes four major processes, that is transduction, transmission, modulation and perception. Transduction is the first step when the nociceptors or the pain receptors receives the noxious stimuli and they convert the energy into electrical signals. So in this picture we can see the transduction is the process when the nociceptors or the pain receptors receives the noxious stimuli and they convert the energy into electrical nerve impulse, and these electrical nerve impulses are transmitted from the nociceptors to the dorsal horn of the spinal cord, and from the dorsal horn of the spinal cord they divide as small diameter neurons and larger diameter neurons. There are two kinds of nociceptors, that is C fibers and A delta fibers. A delta fibers which conduct the nerve signals faster compared to the C fibers. A delta fibers which carries the sharp pain sensation and C fibers carries the dull aching pain sensation. And these nerve signals which reaches the dorsal horn of the spinal cord, they make a synapse with the spinothalamic tract and via neurotransmitters like substance P. Then these nerve signals are carried upward to the brain and it reaches the thalamus. From the thalamus, these nerve signals are sent to the different parts of the brain, and this process is known as transmission. The nerve signals distributed to the different parts of the cortex like limbic system, somatosensory cortex and reticular system. The reticular system is responsible for the autonomic and motor response, which makes the person to withdraw his hand away from the stimulus, or it helps in protecting from the painful stimuli. The somatosensory system deals with the perception and interpretation of pain, which helps the person to know the intensity, location, duration of the pain, and it also deals with the memory of the previous experience with the pain. Next one is limbic system. Limbic system mainly deals with the emotional and behavioral response to the pain. So that is about the transmission, and awareness of the pain sensation is known as perception. In between that we can find there is a modulation, a process known as modulation. Here the brain interacts with the nerves and it alters the intensity or duration of the pain, either modulates or alters the intensity and duration of pain. And modulation is the main concept which helps to explain why the pain experience varies among different people. Next, we will see the signs and symptoms associated with the pain. So, when we experience pain, we also experience some of the associated symptoms like increased respiratory rate, increased heart rate, peripheral vasoconstriction, pallor, diaphoresis, dilated pupils, moaning with the pain, guarding the area. So, when a person have pain, he usually protects the area of the body which is having pain, and he also becomes restless and irritable. So, these are the signs and symptoms of pain. So, with this I will conclude my session that pain is a distressing feeling often caused by intense or damaging stimuli. Pain motivates the individual to withdraw from damaging situations, to protect a damaged body part while it heals, and to avoid similar experiences in the future. Even though pain is unpleasant, it also works as a protective mechanism. And these are the references, and thank you.